Did you know that fibromyalgia affects women up to 8 times more often than men? That's a staggering disparity for a condition that's still so misunderstood. Hello, everyone. Welcome back to Reem Healthcast. Today, we're talking about something where people might look completely fine on the outside, but they're actually dealing with a lot internally. Today, we are talking about fibromyalgia. So let's start simple. What is fibromyalgia?
Well, if you break down the word, it comes from three roots: fibro, fibers; myo, muscles; and algia, pain. It literally means pain in the muscles and connective tissues. And that's really what people experience: widespread pain, tenderness, fatigue, and a general sense of exhaustion without a clear cause. And what's interesting is that it's not a new condition.
Is it?
It was officially recognized in 1979, but it likely existed long before that. Doctors started paying more attention when patients kept reporting persistent pain and fatigue that didn't show up on tests or scans.
Why is it not just pain?
Think of it like a car alarm. Normally, it only goes off when there's a real threat. But in fibromyalgia, it's as if the alarm is stuck on, blaring constantly, even when there's no danger. This happens because of central sensitization, a misfiring of the brain's pain processing system. In simple terms, the brain overreacts to normal signals, translating them into pain. Unlike arthritis or injuries, where actual tissues are damaged, fibromyalgia pain is real but not caused by tissue injury. It's the brain's wiring that amplifies normal sensations into painful ones.
That's such a clear way to explain it. Why is it often misdiagnosed?
For years, fibromyalgia was considered a mystery illness. Many patients were told it was all in their head because tests showed no abnormalities. Symptoms overlap with other conditions such as thyroid gland disorders, vitamin D or B12 deficiencies, inflammatory conditions like lupus or arthritis, or chronic fatigue syndrome. This overlap often led to misdiagnosis or underdiagnosis. However, thanks to growing research, advocacy, and patient stories on social media, fibromyalgia is now better recognized as a legitimate chronic pain condition. And the fact that it's invisible to most diagnostic tools just adds another layer of complexity. I mean, imagine living with constant pain and fatigue, only to have doctors tell you there's nothing wrong because your tests look normal.
Do we know what actually causes fibromyalgia?
Not exactly, but there are several contributing factors: genetics, stress, trauma, infections, and even psychological factors like anxiety or depression.
So, what do patients usually experience?
They experience widespread pain, severe fatigue, poor sleep, and brain fog that can make even basic tasks feel impossible. It's like your body is fighting against you every single day. And what makes it even more frustrating is the unpredictability. One day you might feel okay, and the next, you're completely sidelined by a flare-up. It's like living with a body that has its own agenda.
That's a great way to put it. So, if tests don't show it, how do doctors diagnose fibromyalgia?
Doctors use four key elements to suspect and diagnose fibromyalgia. Widespread pain. Pain should affect multiple regions: upper limbs, arms, shoulders, jaw, or lower limbs, hips, legs, back, abdomen. Duration. Symptoms must be chronic, persisting for at least 3 months or longer. Associated symptoms. Fibromyalgia usually comes with severe fatigue, unrefreshing sleep, and brain fog. Exclusion of other conditions. Doctors rule out other explanations such as thyroid disease, vitamin deficiencies, or arthritis before confirming fibromyalgia.
Given the unpredictability of symptoms, must make it so hard to plan anything: work, social events, even just daily routines. How do you manage something that feels so out of your control?
That's where a comprehensive approach to management comes in. There's no one-size-fits-all solution, but with the right combination of medical treatments, lifestyle changes, and support, it is possible to regain some control and improve quality of life. And that's why it's so important to approach fibromyalgia as a whole-body condition. It's not just about managing pain, it's about addressing the emotional and psychological aspects too. And it's important to know that traditional painkillers often don't work for fibromyalgia pain. They're not addressing the root cause, which is in the brain, not the muscles. That's why managing fibromyalgia often requires a multifaceted approach. Medications can help, but they're just one piece of the puzzle.
So, what kinds of medications are typically used?
Antidepressants are a common option because they can regulate serotonin and other brain chemicals, which helps reduce pain sensitivity and improve sleep. Pain modulators target nerve overactivity, and supplements like magnesium and vitamin D can address specific symptoms like muscle tension and fatigue.
But as you said, medications are just one piece of the puzzle. What about lifestyle changes?
Lifestyle adjustments are crucial. Gentle, low-impact exercises like yoga, Pilates, or walking can improve muscle strength and reduce stiffness. But it's a balancing act. You don't want to overdo it and trigger a flare-up. Psychological therapy. Counseling can help patients manage the emotional toll of chronic pain. Cognitive behavioral therapy, CBT, proven to reduce pain perception, improve coping strategies, and enhance sleep quality. And then there's sleep hygiene, things like maintaining consistent sleep and wake times, limiting screen use before bed, and creating a calm environment can make a big difference. Stress management is another key area. Techniques like meditation, deep breathing, and journaling can help lower stress and protect against flare-ups. And diet plays a role too. Staying hydrated, eating anti-inflammatory foods, and avoiding triggers like caffeine and processed foods can all help. And during flare-ups, self-care becomes even more important. Simple things like preparing easy-to-make meals, practicing relaxation techniques, or taking warm baths can help ease tension and conserve energy. And for those who need additional support, there are advanced interventions like lymphatic drainage massage, posture correction therapy, and even experimental approaches like neuromodulation or hyperbaric oxygen therapy. These might not be mainstream yet, but they're showing promise in early studies.
It's exciting to see how research is evolving. And it's not just about treatments. There's also a growing understanding of the condition itself.
Exactly. And that brings us to the coping framework, a triad approach of medical support, lifestyle care, and community connection. Think of it as a three-legged stool. If one leg is missing, the whole thing collapses. But when all three are in place, it provides stability.
That's such a powerful image. Fibromyalgia is far more than just pain. It's a complex, chronic condition that affects the brain, body, and emotions. But with awareness, early diagnosis, and a comprehensive management plan, patients can reclaim control and improve their quality of life.
And with ongoing research, who knows? We might even see breakthroughs that lead to prevention or a cure in the future. For now, though, it's about taking it one step at a time, building a life that works for you, even with fibromyalgia.
Absolutely. And for anyone listening who's dealing with fibromyalgia or knows someone who is, remember, you're not alone. There's a whole community out there, and there's always hope. And with that, we've reached the end of today's episode. A big thank you to our listeners for tuning in. We hope this conversation helped you better understand fibromyalgia and how to manage it. Stay tuned for our next episode, where we'll continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.